Amlodipine is one of the most commonly prescribed blood pressure medications in the world. Millions of seniors take it every single day, and for many people, it works extremely well. But over the years of managing patients in my clinic, I have watched older adults make small, repeated mistakes with amlodipine that quietly reduce its clinical effectiveness, drive up unnecessary side effects, or create severe cardiovascular risks they never saw coming. This does not happen because the medication itself is dangerous. It happens because the biological framework taking it has fundamentally changed. After 60, your internal architecture operates within a completely different set of rules. Your blood vessels naturally become less flexible, your physical balance becomes more fragile, your daily medication use typically increases, and cellular recovery takes significantly longer. Which means that managing hypertension is no longer just about blindly swallowing a pill and hoping for the best. It is about actively avoiding the subtle, everyday errors that quietly work against your treatment. Today, we are opening a strict clinical review into 7 amlodipine mistakes seniors should absolutely know about after 60. And the most dangerous one isn't grapefruit juice, nor is it a complex drug interaction. It is a mistake many people make precisely because they think the medication is working so well. I am Dr. Jonathan Reid. Let's look directly at the clinical reality of what is happening inside your body so you can protect your longevity. Number 7. Taking amlodipine at different times every day. We begin our review with a widespread behavioral habit that directly undermines how this medication regulates your vascular system. Treating your daily dosing schedule as a flexible option. When you are busy with your morning routine, running errands or traveling, it is incredibly easy to adopt the comfortable mindset that as long as you take your pill sometime today, you have checked the box and fulfilled your medical duty. From your perspective, you are still practicing reliable medication compliance. From a clinical perspective, however, consistency is a fundamental part of the actual treatment. The underlying physiological mechanism rests on how amlodipine maintains stability inside your bloodstream. This medication is designed to work smoothly over a long period, but it relies on your body maintaining a steady, predictable concentration of the compound to keep your blood vessels relaxed. When you take it at 8 in the morning on Monday, but then delay it until 2 in the afternoon on Tuesday, you create large, unnecessary variations in those blood levels. This scheduling instability forces your older blood vessels to endure fluctuating blood pressure and highly inconsistent control throughout the week. Many seniors look at their shifting blood pressure numbers and immediately conclude that the medication itself has stopped working consistently, when the reality is that the schedule itself is completely inconsistent. To protect your system, you must lock in a precise routine and take your dose at the exact same time every single day. Number 6. Drinking grapefruit juice regularly. We move next to a highly localized dietary mistake that targets a very common breakfast tradition: drinking grapefruit juice regularly, under the blanket assumption that all fruit products are naturally beneficial. When you pour yourself a cold glass of grapefruit juice in the morning, your intentions are entirely healthy. You view it as a fresh, nutrient-dense source of vitamins that supports your immune system and general longevity. From your perspective, you are making a conscious, disciplined choice for your body. From a clinical perspective, however, this specific interaction introduces a severe metabolic barrier that can easily push your body into a state of medication toxicity. To truly understand how this manifests, consider the case of a patient named Margaret, a 67-year-old retired school teacher who came to my clinic suffering from sudden, terrifying bouts of extreme lightheadedness and massive, uncomfortable swelling in both of her ankles. Margaret was incredibly diligent about her health and took her amlodipine at the exact same time every single day. Her previous doctor couldn't understand why her blood pressure was suddenly plummeting to dangerously low levels and assumed her cardiovascular system was failing. But when I closely audited her daily habits, the mystery vanished. 2 weeks prior, Margaret had started drinking a large glass of fresh grapefruit juice every morning with her breakfast, believing it would help lower her cholesterol. The underlying biochemical conflict comes down to how your liver breaks down chemicals. Grapefruit contains potent organic compounds that completely deactivate a crucial enzyme in your digestive system, responsible for metabolizing amlodipine. When this enzyme is blocked, your body cannot break down the medication at its normal, expected pace. As a direct result, Margaret's system was absorbing nearly double the amount of amlodipine than I had prescribed, causing the drug to spike to toxic levels in her bloodstream. The fundamental problem here is absolutely not the grapefruit itself. It is what happens when grapefruit and this medication meet inside an older metabolism. Once we had Margaret completely stop the grapefruit juice, her blood pressure stabilized, and the severe ankle swelling disappeared within days. To keep your system safe and predictable, you must ask your physician whether grapefruit is appropriate for you, or simply choose a safer citrus alternative. Number 5. Ignoring new dizziness. We turn our attention next to a subtle and frequently rationalized symptom that older adults routinely dismiss as a normal part of the aging process: ignoring new or worsening bouts of dizziness. When you stand up from your favorite chair, get out of bed in the morning, or turn your head quickly and feel a brief, floating sensation of instability, it is incredibly easy to brush it off. You tell yourself that your body is simply slowing down, or that your balance isn't what it used to be. From your perspective, you are practicing a form of stoic acceptance. From a clinical perspective, however, this new dizziness is a critical biometric signal that your blood pressure may be dropping significantly lower than your body can safely tolerate. The underlying physiological mechanism relates directly to how amlodipine functions within your vascular network. Amlodipine works by relaxing and widening your blood vessels to lower systemic pressure. But in an older biological framework, this widening effect can occasionally become too pronounced. When your blood vessels remain overly dilated, your body struggles to quickly pump blood upward against gravity to fully oxygenate your brain when you change positions. This creates temporary cerebral hypoperfusion, which manifests as lightheadedness and physical instability. The ultimate danger here is that not every symptom of aging is actually aging. When you ignore this signal, you aren't just tolerating a mild inconvenience, you are leaving yourself highly vulnerable to a sudden loss of balance. A preventable dizzy spell can easily lead to a catastrophic fall, resulting in a life-changing injury that permanently compromises your mobility. To protect your independence, you must immediately report any persistent or new dizziness to your healthcare provider. Number 4. Standing still for long periods. We move next to a subtle structural hazard that many seniors completely overlook, simply because they fail to see how a static physical posture could possibly connect to their daily prescription: standing completely still for long periods of time. Whether you are waiting in a long line at the grocery store, attending a social gathering, or working on a hobby at your counter, you likely view standing in place as a perfectly healthy, low-impact habit. From your perspective, you are keeping your body upright and active. From a clinical perspective, however, combining prolonged immobility with amlodipine's specific mechanism creates a perfect physical storm for extreme vascular pooling and severe lower limb discomfort. The underlying physiological problem comes down to the mechanics of your circulation. When you stand completely still for extended stretches, your body must rely entirely on the rhythmic contraction of your calf muscles to pump blood upward against gravity, back toward your heart. However, because amlodipine works by deeply relaxing and widening your peripheral blood vessels, it significantly amplifies the natural tendency of blood to pool in your lower extremities. Without the active pumping motion of your muscles to push that fluid back up, gravity wins. The delicate vessels in your lower legs stretch under the constant pressure, causing watery fluid to leak out into the surrounding tissues. Many seniors experience this sudden heaviness and swelling, and immediately blame the medication alone for their discomfort, failing to realize that their static lifestyle situation contributed just as much as the chemical pill. To protect your lower circulation and prevent this painful fluid accumulation, you must make it a priority to move periodically, shift your weight, and completely avoid prolonged, stationary standing whenever possible. Number 3. Taking ibuprofen regularly without asking your doctor. We turn our focus next to an incredibly common behavioral error born out of a simple need for daily comfort: taking ibuprofen regularly without ever consulting your physician. When you are dealing with chronic lower back stiffness, minor arthritis flares, or a nagging tension headache, it is completely natural to reach into your medicine cabinet for a standard over-the-counter pain reliever. You view it as a harmless, everyday asset that allows you to maintain your active lifestyle. From your perspective, you are managing your pain responsibly. From a clinical perspective, however, this high-frequency pattern creates a silent chemical conflict that can completely neutralize your blood pressure control. To understand how this manifests, let me tell you about a patient of mine named James, a 69-year-old retired mechanic who took great pride in maintaining his home garden. James had been taking amlodipine for 2 years with excellent results, but as the spring season started, his chronic knee stiffness began to flare up from the extra yard work. To cope with the discomfort, he started taking 2 ibuprofen tablets every single morning. He assumed that because it was available without a prescription, it was entirely safe to combine with his regular medication. Within 5 weeks, James came into my clinic for a routine checkup, and his blood pressure numbers had skyrocketed back into a dangerous red zone. He was deeply confused and highly anxious, believing his amlodipine had suddenly stopped working and that his cardiovascular system was rapidly deteriorating. The underlying medical reality centers on a direct biochemical clash inside your kidneys. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen, work by blocking specific enzymes to reduce pain. However, this same mechanism causes your blood vessels to constrict and forces your body to retain significantly more fluid and sodium. Because amlodipine's entire job is to relax your blood vessels and lower systemic resistance, ibuprofen acts as a direct chemical antagonist. The medication didn't suddenly stop working on its own. You introduced something that started actively working against it. Once we had James safely switch to a non-interfering pain management strategy, his amlodipine was able to do its job again, and his blood pressure normalized within 2 weeks. To protect your vascular system, you must discuss regular NSAID use with your physician before combining them. Number 2. Stopping amlodipine because of ankle swelling. We address next a highly reactive behavioral mistake that occurs when sudden physical discomfort triggers a state of medical panic, abruptly stopping your amlodipine because you noticed swelling in your ankles. When you look down at the end of the day and discover that your socks are leaving deep, indented rings around your ankles, or that your favorite shoes feel uncomfortably tight, it is completely natural to feel alarmed. Your immediate, logical conclusion is that the medication is actively harming your body, and that the safest course of action is to stop taking it immediately. From your perspective, you are protecting yourself from a visible side effect. From a clinical perspective, however, this sudden discontinuation can trigger a dangerous, volatile spike in systemic blood pressure. The underlying physiological reality is that lower limb swelling, or peripheral edema, is a well-documented, localized side effect of amlodipine. It happens because the medication relaxes the tiny muscle walls of your arteries much more than it relaxes your veins, causing a minor fluid shift down into your lower tissues. While this swelling may need professional attention, the medication itself may still need a careful, long-term plan. When you suddenly yank amlodipine out of your biological system, your relaxed blood vessels can experience a violent rebound effect, constricting sharply and driving your blood pressure up to dangerously elevated levels. This rapid loss of control drastically increases your immediate risk of an acute cardiovascular event. The swelling may be an uncomfortable nuisance, but a sudden stroke is catastrophic. You must always consult your physician to safely adjust your dose or transition to an alternative therapy rather than making a frantic decision on your own. Number 1. Skipping doses because you feel fine. We have arrived at the absolute climax of our clinical review, the most pervasive, deceptive, and structurally dangerous behavioral mistake an older adult can possibly commit: skipping your doses entirely simply because you feel perfectly fine. When you wake up in the morning, check your blood pressure monitor and see a beautiful, stable reading of 120/80. A very comforting but dangerous illusion takes hold in your mind. You conclude that your cardiovascular system has fully healed, or that your body no longer requires the chemical assistance of a daily pill. From your perspective, stopping the medication is a rational response to feeling healthy. From a clinical perspective, however, this is a profound misunderstanding of asymptomatic pathology that can leave your brain and heart completely unprotected against a sudden vascular catastrophe. To understand how devastating this illusion can be, consider the case of a patient of mine named Arthur, a 71-year-old retired contractor who prided himself on his disciplined lifestyle. Arthur had been taking amlodipine for over a year, and his blood pressure had stabilized beautifully. Because he felt full of energy and displayed zero physical symptoms, he secretly decided he didn't need to depend on a prescription anymore. He began skipping his doses, taking the pill only when he felt stressed. 3 months later, Arthur was rushed to the emergency room in the middle of the night, experiencing a massive, debilitating hemorrhagic stroke. The tragic reality was that Arthur's blood pressure wasn't normal because his hypertension was gone. It was normal precisely because the amlodipine was working flawlessly in the background to keep his vessels dilated. The underlying biological danger rests on the fact that high blood pressure is universally classified as the silent killer. Your vascular walls possess no sensory nerves that broadcast pain or discomfort when pressure rises to a dangerous red zone. Many people feel exactly the same whether their systolic pressure is a safe 115 or a lethal 190. When you miss doses, amlodipine's protective framework completely vanishes, forcing your fragile, aging arteries to silently absorb an immense, unbuffered pounding. The most dangerous blood pressure mistake always happens on the day you finally feel well. The medication did not suddenly become unnecessary. It became so remarkably effective that you forgot exactly why you started taking it in the first place. To safeguard your longevity and protect your independence, you must commit to your daily schedule and never alter or skip your prescribed dose without an explicit clinical plan from your healthcare provider. Managing your blood pressure after 60 is no longer about finding a generic way to lower a number on a digital screen. It is about conducting a precise, daily clinical defense of your changing biological architecture. The micro-decisions you make inside your home, your kitchen, and your medicine cabinet can either act as a constant source of hidden cardiovascular stress, or they can serve as the exact structural scaffolding your heart, your brain, and your kidneys require to maintain long-term physical independence. By systematically eliminating the behavioral inconsistencies and the hidden chemical conflicts we have uncovered today, whether that means maintaining a strict daily dosing schedule, avoiding the metabolic trap of grapefruit juice, moving your body to prevent lower limb fluid pooling, or refusing to let over-the-counter pain relievers quietly neutralize your prescription, you are giving your body a magnificent margin of safety. You are choosing to work in perfect harmony with your internal chemistry, rather than forcing an older, far more sensitive vascular system to constantly fight a volatile, uphill battle against fluctuating pressures. Success with amlodipine is never just about blindly swallowing a pill because a doctor handed you a prescription sheet. True success is about actively avoiding the tiny, everyday mistakes that can quietly work behind the scenes to completely undermine that treatment. Never allow the dangerous illusion of feeling perfectly healthy to trick you into dropping your guard. And never alter your clinical routine without an explicit, structured plan from your healthcare provider. Because at the end of the day, healthy aging isn't only about the medications you take. It is also about understanding how to help those medications do the exact job they were prescribed to do. Healthy longevity is never an accident of luck or simple genetics. It is the direct mathematical result of the microscopic boundaries, defensive habits, and smart choices you establish every single day. Take absolute control of your cellular health. Look past the comfortable assumptions and give your medications the exact environment they need to protect your life. I am Dr. Jonathan Reid. Thank you for spending this valuable time with me today. Invest deeply in your health, protect your biological architecture, and I will see you right here in our very next clinical breakdown.